Серцево-судинна система.
Cardiovascular system. Palpation of the heart region. Palpation of the heart region is used for determination of the apical impulse, the heart lift, and thrills in the heart region. Palpation of the apical impulse is performed in 3 steps. First step. To locate it, place the right hand in such a way that the right middle finger is placed on the 5th intercostal space. When you feel an impulse beneath this finger, the finger is correctly placed on the apex. Second step. Rotate your hand as shown, so that the fingertip of the right middle finger is placed above the center of the apex. Third step. Point out the center of the apex. Palpation of the heart lift. Normally, the heart lift is not palpable. It is palpated in case of intensified work of the right ventricle. The next step is estimation of thrills in the heart area. Diastolic thrill is produced by mitral stenosis. It can be felt on the area of the heart apex. Systolic thrill is produced by stenosis of the aortic orifice at the area of the second right intercostal space, or stenosis of the pulmonary artery orifice at the area of the second left intercostal space. Sometimes we can palpate the pericardial friction rub. Percussion of the heart. Percussion of the heart includes locating the borders of relative dullness of the heart, borders of absolute dullness of the heart, width of the vascular bundle, determination of additional points on the right and left contour of the heart, estimation of the angle of the heart, sometimes also called waist of the heart, estimation of the heart configuration. Before estimating the borders of relative dullness of the heart, it is necessary to locate the position of the diaphragm. On the right mid-clavicular line, percuss downwards until a flat sound, not to dull sound, but to flat sound. In this area, the lung tissue still covers the liver. In a normal standing individual, the diaphragm is located normally on the level of the lower edge of the 5th rib. Move upwards by 1 intercostal space. Turn the finger for 90 degrees and percuss in the direction of the presumed right border until a flat sound. Next, we estimate the left border of relative dullness of the heart. First of all, it is necessary to locate the position of the apical impulse. Move 3-4 cm to the left from the position of the apical impulse. Percuss in the direction of the apex. If the apical impulse cannot be palpated, then percuss from the left anterior axillary line. Next point is the upper border of the relative dullness on the parasternal line. Next step is the estimation of the absolute dullness of the heart, that is the part of the heart which is not covered by the lungs. Percuss from the borders of relative dullness gently until a dull sound.
тихої перкусії до тупості.
In most cases, the left borders of the absolute and relative dullness coincide. Anyway, it can be located. In this patient, there is no big difference. And estimate the upper border of the absolute dullness of the heart.
Це є ділянка серця, яка не прикрита.
This is the area of the heart not covered by the lungs, the area of absolute cardiac dullness.
Ширина судинного пучка.
Width of the vascular bundle. In the second intercostal space, from the right and left midclavicular lines, respectively, percuss in the direction of the sternum very gently. It is necessary to stress that while estimating borders of the relative dullness of the heart, we percuss with moderate strength until a flat sound. While for determination of the absolute borders, percussion must be gentle and we percuss until a dull sound. Next, determine additional points on the right and left contours of the heart. Additional point on the right heart contour lies in the third intercostal space. In the second intercostal space, the right border of the vascular bundle is located. In the fourth intercostal space is the right border of relative cardiac dullness. On the left, we determine the additional points on the third and fourth intercostal spaces. Connecting these points, we estimate the right and left contours of the heart which form the cardiac silhouette. On the left heart contour, we estimate the angle of the heart, also called waist of the heart. The angle of the heart is the angle between the vascular bundle and left border of left ventricle. Normally, this is an obtuse angle. When the left ventricle is enlarged, the angle approaches 90 degrees and becomes more prominent. Such configuration of the heart is called aortic. When enlargement of the left atrium is present, the angle is smoothed out approaching 180 degrees. Such heart configuration is called mitral and is characteristic of mitral valvular diseases. Auscultation of the heart. Heart auscultation is carried out in the next sequence. Initially, auscultate the mitral valve in the region of cardiac apex. Next, in the right second intercostal space, evaluate the work of aortic valve. In the left second intercostal space, evaluate the function of the pulmonic valve. Near the base of the sigmoid process, evaluate the function of the tricuspid valve. Besides these four basic auscultative points, there are several additional points. One of the most frequently used is the fifth point of Earp, also known as Brodkin-Earp's point. It is located in the point of the left fourth chondrosternal joint in the region of the fourth intercostal space. Heart auscultation must be performed in the standing position, supine position, and in certain cases with the patient lying on his left side.